Hello, Dr. Daynaev here from Steinway Family Dental Center. We get a lot of questions about periodontal disease. So today I'm going to answer some of the most common questions that we get from you guys about periodontal disease. The first question is, what is periodontal disease? Well, periodontal is a coined word. It consists of two. Perio means around, dental is tooth, right? So it's around the tooth disease. And I'm pretty sure all of you heard of the disease called gingivitis. That's one of them. And gingivitis is a reversible condition of soft tissue, basically the gum, right? The gum is inflamed because something is insulting the gum. Most likely it's called biofilm. It's basically food mixed with bacteria that is sitting on the surface of the tooth and creeping into the gum, right? And we get gingivitis. Like if you had lunch today and you didn't brush your teeth after lunch until you get home, you have gingivitis. It is a reversible condition, however. So as soon as you get home, you brush your teeth and gingivitis is gone. However, there is a second disease that's called periodontitis. And again, perio means around, dentitis is tooth. So, and it's around the tooth, but it already goes deeper into the gum and it went to the point where there is bone support. And now it's affecting the bone and the bone starting to melt around the teeth. And that is periodontal disease. Now, unfortunately, it is completely painless because the nerve comes from the bottom of the root, right? So it's way deep inside the bone. So until you lose all the bone, you feel nothing. And therefore, it would be best to see a dentist to see if you have that or not, because you don't want to lose your teeth, right? What are the causes of periodontal disease? Well, there are a few. Number one, it could be hereditary, right? It could come from your parents or from your grandparents and so on. That's only part of it. The next part would be the teeth alignment. If the alignment is off, then of course you can get more and more gum disease. However, the previous generation did not have teeth aligned well. The new generation now has more alignment in their teeth, and therefore periodontal disease are less prevalent in that. So yes, it could be actually fixed. And the next thing is, of course, it depends on how often do you get to see your hygienist or your dentist, right? Whoever's going to clean your teeth for you in a dental office, that is the person that you want to see regularly. And the last portion would be you get gum disease if you don't take care of your teeth properly at home. If you don't brush and floss regularly the way you're supposed to, then of course you get gum disease. Next question is, what are the symptoms of the periodontal disease? Most of the symptoms is sometimes when you brush your teeth, you feel like you have little blood coming out, right? And if you're spitting blood when you brush your teeth, then yes, you do have periodontal disease. And it is active right that moment. You also can get a little discomfort, a little redness in the gum. Sometimes you look at it and the edges right around the teeth look, instead of being light pink color, it is purplish color kind of. There is difference in color there. That is a sign of chronic inflammation, which is a sign of gum disease. So if you get any of that, I recommend you to see your dentist. Next question is, what are the conditions that connected to periodontal disease? Well, there are few, right? If we have inflamed gum, the inflammation in the gum that is chronic inflammation, it does affect a lot of stuff. Number one, if we have bacteria in there and periodontal disease known to have bacteria in there, all of these bacteria through the blood streams have access to the heart, right? Because that's where all the blood goes. So this bacteria sits in your bloodstreams like on a big water slide, and the next stop is your heart. So, and if that bacteria can cause trouble with your gums, can it cause troubles with your heart? Absolutely, right? So that's only one direction that it can take. The other direction is, I know that a few years ago, New York Times did research on it, and they find out that the bacteria produces certain protein that can cross brain barrier. Brain has a filter, so not even all the medicine can penetrate through to the brain. It's like getting the screen, and the screen only have very fine particles that can go through. But protein that produced by that bacteria can get inside the brain, and it binds to the receptors in the brain that will have an onset of early dementia and Alzheimer's. So that is another thing that can be caused by gum disease, early onset of dementia and Alzheimer's. The next one would be chronic inflammation. We know how the cancer happened, right? So first there is an effect, and the cells start becoming different than all the other cells. And if there is a chronic inflammation, that can lead to that. Of course, everybody remembers the COVID time. People with gum disease had harder time recovering from COVID, right? Because the inflammation is already there. So they're tired more and so on. So the best way is, I guess, not to have, but there is a lot of things that correlates with the gum disease. Next question is, can periodontal disease be cured? Well, it's interesting because all of this, the heart disease, right, the diabetes that can be helped with the gum disease, and the dementia and so on, they all can be treated but cannot be cured. However, the periodontal disease that can contribute to cause all of that can be treated and can be cured. So if you want to treat it and cure it, the sooner you start, the better the chance you have to fix it completely. Now the next question is, what treatment options are available for fighting periodontal disease? Well, there is an array of different treatment. Number one could be just coming and getting your cleaning on time, right? Number two, maybe it would be required that you align your teeth, right, along the side of getting a deep cleaning or a regular cleaning. Maybe it is just the time for you to get your cleaning more often, and that would cure it. Of course, if it is later in the disease, right, stage, then maybe it would require some kind of a surgery. And just like anything else, when it is a complete end of it and you lost a lot of bone all the way to the point that the teeth are flopping in the air already, then maybe it's time to get rid of them and replace the bone and replace the teeth with some implants or something else. Another popular question we get is, are teeth cleaning and painful? And the answer is not really. When the cleaning done properly, it should not be painful. And if you're doing it often enough and you're taking care of your teeth at home, then there is no reason why it should be painful. I hope that was helpful about the periodontal disease. If you have any further questions that I didn't answer in this video, there are other videos available about that, but you can also just come in and have a consultation with me personally, and I will help you out. So give us a call, 718-728-3314, and request an appointment.